Welcome to Data Chats, a Metopio podcast where we talk about turning community data into real-world action. Each episode, we explore how leaders across public health, hospitals, and policy use data to understand their communities, shape priorities, and drive change. Let's dive in. Hi, Heather. I am eager to talk to you today about maternal child health. This is one of those topics that I feel like we could easily spend an hour on, but
Oh, definitely.
we'll try to keep it short today. I have just a few maps to start with, and we can see where this goes.
Yeah.
The first map I pulled up was hospitals with obstetric care per capita. And I'm starting right in the middle of maternal child health because it's important to think of this as a spectrum, and it's not just that small amount of time when someone is pregnant and having a child, but that's what I'm starting to zero in on, and then maybe we can expand into other things that affect the true health of mother and infant.
Oh, definitely. And this is a critical part of what we call maternal care deserts. It's not just obviously the hospital care, as you say, but not having any obstetric care for hundreds of miles gets to be a problem. And you can see large parts of the country where really you are talking about hundreds of miles. Other parts of the country are really well provided for, or moderately well provided for at least. But yeah, there are definitely areas where not being able to get to the hospital is going to be a key issue.
Yeah, as you were saying that, I'm looking at Montana and North and South Dakota. I mean, if you're in one of these counties, I can imagine it takes hours to even get to a hospital where you could be cared for. I also pulled in breastfeeding initiation, and I love this topic. We did just kind of an analysis of a lot of topics in our database and looked at what topics predicted poor health outcomes, essentially, like cancers and diabetes. And this was one that showed up over and over and over again as a predictor of a poor health outcome.
Yep.
And it's not just the breastfeeding itself. I think it's almost the canary in the coal mine here. Are people engaging in health-related behaviors? Are they getting the prenatal care and advice? Do they have the time? Or
And
are
the
they going
support.
back to work? And the support, yeah.
Yeah. And
Sorry.
you can see really big differences across the country that are not just regional differences. They're not just rural urban differences. There really are areas where, moms are going to have a harder time doing this one thing. And as you say, a canary in the coal mine, this could reflect a lot of other things that are more difficult. If this, represents moms who have to go back to work really quickly, or moms who don't have that kind of family support or medical support to get breastfeeding started, that's going to be reflected in other outcomes too.
And this is an index that we built where we're looking at access to care. But again, we started with this, and it's definitely interesting. It shows interesting patterns, but we start to ask, is this really the index? If we're building an index and we want to encompass everything, is this really the one that encompasses maternal child health, or could we go broader? And that's where we went with this maternal hardship index. And this
that's a big difference. Yeah.
Yeah, this one it takes everything from what is the mother's health before she gets pregnant to after that child is born. Do they have access to affordable childcare, things like that?
Well, as you say, it isn't just the birth, it isn't just the initiation of breastfeeding, it's the whole time period. It's before the pregnancy and after. I did want to call out, when you say we built an index, this is one of the custom indices that you can build in Metopio, and that's a whole other topic for another day. But it means that we've put together a lot of the pieces of data that we have access to from other sources, like you said, childcare costs, pre-pregnancy health. And I think that's one that never gets quite the attention it deserves, because there's a lot of focus on prenatal care for good reason. It's important. But the health of the mother going into the pregnancy matters at least as much. And when that isn't taken care of, when there's, higher rates of uninsurance, when, moms or moms to be can't keep their own health, uh, can't do the things they need to do to keep their own health. Then they go into the pregnancy in worse condition, and then they come out of the pregnancy in worse condition. But I do love that we've been able to put those pieces together here into an index that really reflects all of that from start to finish. It really is different from the one we just looked at.
What about these dark
So yeah, when you get
counties?
spots like that, and I know at least one of those is a Native American reservation. Sometimes when you get those little bits lighting up, especially in the Plain States, the Navajo Nation down in Arizona is an obvious
Yep.
one standing out. But that reflects a very different experience for people who do live on reservations. That's a whole other topic again that we could talk about in another podcast. But yeah, that sort of shows you what we're seeing in that data. There are real differences in people's experiences. There are real differences in their access to healthcare, their access to insurance. All of those things vary, sometimes shockingly, in a small area. Like
hmm
there are huge differences.
That
And
actually
here's
segues
Chicago.
perfectly into this, shockingly in a small area. So
Mhm.
this is the calculation of the maternal health hardship index at a sub-county level was slightly different because not all of the indicators available at a county level are available at a sub-county.
Sure.
But we still have some interesting patterns. And so you can see this is our Cook County map. And there's clear disparity here on the south side of Chicago.
And the West.
And then relatedly, if we look at something like Texas, you can see maternal hardship is not too bad in um, these
Houston and
urban
Dallas.
areas.
Hmm.
Yeah.
Yep.
But if you zoom in though on these individual cities, then you start to see the disparities within the city itself.
Yeah. And that gets to like the difference between, a rural area and an urban area. Just across the country, not that either rural or urban areas have the corner on things going badly, but that in an urban area, you frequently get much bigger differences in a smaller area. That the difference between the suburbs and the city core might be different, the north side versus the south side, very specific neighborhoods. It makes a difference. And that's part of why that sub-county data is so key, that we can't just say Cook County. We can't just say, a
Hmm
whole county, because within that, especially in an urban county, you have so many variations that the census tract matters, the zip code matters, the neighborhood matters. And being able to do it at that level really, really is key, as you showed.
Yeah. And as you say that, for me as a senior data analyst of Metopio, that's a challenge. That's an ongoing challenge.
Oh, yeah.
Actually getting the data at the sub-county level, and then right now, concerns about the reliability of the data actually coming out as planned. Um,
Hmm.
so I think that actually can segue into the next thing I wanted to talk about, which is that a lot of states have outstanding data sets related to maternal child health and other topics. But this is a North Carolina data set looking at fetal mortality rate. And then they have a lot of great maternal child health data,
Oh,
abortion
yeah.
rate, termination.
Hmm.
And so that's always an option when clients have an interest and it's not being met with federal data sources, we can
Hmm.
look at state sources.
Yep. And frequently the federal data sources are fed by state sources. So going back to the source can be exactly what we need.
I pulled this plot in because sometimes we can't get exactly what we want from the indicators, but I also like to always think about how can I think creatively about the data I already have. And so one thing we can do with a lot of Metopio data is pull in a topic and then look at the stratifications for 0 to 4 years in this case, or
Hmm.
maybe childhood, or maybe you want to look at that the like childbearing age
Yeah.
stratification.
The young adult women. Yeah, definitely.
hmm
And that
So
gets
here we,
again to that more longitudinal look at things.
yeah. And again, we're seeing a lot of the same patterns here, right? We see
Navajo Nation again.
Navajo Nation, border
Hmm.
counties. That's pretty common. And when we start to see these same patterns too, we see them in maternal infant health. It was a very clear pattern in that index of the hardship index I showed you. I got this question recently where someone said, okay, this is great, but it looks exactly like the other maps I've seen. So how can we look at these maps and we're seeing the same pockets of disparity? And how can we look at a new indicator and say it's something different and not just the same disparity
Right.
map? How do we think
And
about that at Metopia?
it comes down so frequently to how many different ways you can say poverty. Like so many things are going to
Yeah.
correlate with poverty. You're going to have, problems compounding on top of problems. And it's hard to tease those out. I mean, speaking as a statistician, there are definitely ways. there, there are ways to say, we've got 50 ways of saying poverty, and they're all telling you the same thing. In some cases, though, one of them is going to work better than another. Food deserts, for instance, and food insecurity. When you take food deserts and food insecurity and poverty, in almost every case, they align because in order to have food insecurity, you almost certainly have to have poverty. In order to have a food desert, you end up, in a place where people either can't afford to support a proper grocery store, or the other economic factors that are driving the poverty are also driving the lack of grocery stores. And so all of them tend to travel together. But when you see little variations in, higher poverty, but you still have grocery stores, or distance, but enough money to actually make that distance to the grocery store less of a problem, you start to see where one of them makes sense and the other one makes sense better in another context. And so, using all the tools of statistics, I won't make everybody learn them, to say, this is the one we're using today. This is the one that predicts what we need to know. And in this case, it is absolutely poverty. It is straight up, per capita income, for instance, versus
Mhm.
it is the number of people who are both under the poverty line and more than 10 miles to a grocery store. Or instead of linear distance to a grocery store, it's the amount of time it takes to get there on the bus. There are hundreds of ways we could do this. And finding that one piece that stands out in this relationship is the key. It does frequently come back to poverty, though. And so if you say, where is there a higher rate of maternal mortality, for instance, it is going to be in places with higher poverty. But where is it even higher than that? And then we start saying, okay, it's not just the poverty, there are other things going on here. Or where has there been an intervention? And we can say that's what brought this down a bit. Maternal mortality is difficult because thankfully they're small numbers. We don't want them bigger. Uh,
Mhm.
but it's hard to pull out stats from that. And so we start looking at these other factors like the uninsured rate or maternal morbidity, those complications that are leading indicators and have more variability in larger numbers, that we can start saying, that one intervention, that, uh, family nurse partnership, for instance, if you did that bring down the risk even a little? Did it bring down the risk a lot? Did it change it in a way that certain, the people that you reached out to could benefit from, even if it doesn't throw the numbers completely down?
Mhm.
Um, but really bringing in all of those subtleties and all of those nuances before we get to the point of mortality that can tell us something about where an intervention could go. And I think,
That's the action point.
yeah, that's exactly it. Because you can't
Mhm.
wait for everything to have gone wrong, poverty and everything to have gone wrong. What can we actually do? So that's where it gets exciting. Complicated, but exciting.
Right. Great. This was a fun talk and fun discussion. And I think we could easily have kept going. We could spend more time on those indices. But thanks, Heather.
Yeah. Thanks for listening to Data Chats. If you found this episode helpful, subscribe to get future episodes delivered straight to your inbox. And if you want to explore the data we talked about today, visit metopio.com to see how we help public health departments and hospitals turn insights into action. See you next time.